So it's still the debate between the hunger virus and coronavirus. Well, joining us to throw more light on this, Dr. Olufemi Oyekon is a public health physician. Welcome to the program.
Thank you for having me.
So hearing the realities of some Nigerians as to what they're going through this period, how would you assess the government coming out to say, okay, so this is the second phase of the national response to COVID-19. This is what will happen the next 4 weeks, what we heard from the PTF yesterday.
Okay. The government is doing its best to salvage the situation. We have to understand that there's need to balance between the medical aspect and the economic aspect, which is very, very important. And until there's a definite pharmaceutical intervention, meaning a approved drug treatment protocol and vaccines, we need to find a way to live with the vaccine. And that's why the government is trying to ease up the economy, and there are steps in doing that, and that's what the Presidential Task Force is doing presently.
So it said that it applied science and data, to coming out with some of these resolutions. But in the area of perhaps the local government areas, 20 of them of the 774 that we've heard, there's a high rate of the infections. How can they concentrate on those particular communities to limit the spread of COVID-19? And would you say that where we're getting more of the cases we're seeing every day, if they're actually from that, or we're having an expanded, cases from those local governments?
It's going to be a bit difficult to say we are focusing strictly on those 20 local governments. We should understand that with the easing down of the lockdowns, people are moving in and out of those local governments. And with movement, there will be increased spread of the disease. And apart from that, it's everybody has a role to play. Apart from the government is doing its best. We as citizens also have our own roles to play. The physical distancing, use of face masks. If you go around the communities now, people are hardly using the face masks. People are hardly doing the personal hygiene. So we as the people, we need to do more. And we understand that we know that even in Lagos, out of the 20 LGAs, 11 are in Lagos. Even in Lagos, as at 4 weeks ago, we did what is called an active case search, whereby we went into the different communities to kind of find out whether people have symptoms of COVID, cough, fever, difficulty in breathing, and things that at Lagos we have done that already. And that's why with the people are saying that in Lagos we are getting more, the number is increasing by the day. We should understand that in Lagos we have many more testing sites compared to when we initially started. In all, we have about 28 testing sites, and we are testing more people by the day, and that's why we're getting that number, and it's actually expected.
So it's also interesting too, the PTF said they will mobilize resources at state and local government levels, but that, more or less is the responsibility of the state governments. The NCDC mentioned that Nigeria has enough reagents for about 100,000 tests, and the challenge is not testing capacity, but the capacity to collect samples.
I understand what they're saying. You should understand that the state itself, the states are the one that are in charge. What they get from NCDs is support. I can speak for Lagos because I've been part of the team going around collecting samples. When there was a lockdown, it was easier for us to go around to collect samples. But now, there's traffic everywhere. So it takes, for you to get sample from one point to the other, it takes a long time. And that will also limit the number of people that you can get tested by the day.
So at the end of the day, with the ease of lockdown, are we moving forward or we're taking 10 steps back?
I would say we are also moving forward. We should understand that Lagos State has also made in each of the 20 local governments, there's a testing site in each of the 20 local governments. Apart from testing at the state level, also at the local government, you can walk in. There are walk-in sites where you can walk in and get tested. So we need to find a balance in all this.
Tell us about your thoughts on the relaxation, places of worship, religious gatherings, and this is, we hear, in line with the safety protocols. Do you think we can monitor, that successfully?
I really don't think we can, because even despite during the lockdown, some churches were still having services. People were clamoring and going also. So I think that's where the people, we ourselves, we need to talk to ourselves. The government are doing their best, but the people, the citizens also, we have a key role to play. Churches, they can use the online medium, and the government has said that less than 20 people
Public gathering.
can be gathered at a point in time. So the churches, the religious houses can also use the online medium in case, and which some of the churches have been doing already.
Let me quickly ask about the mandatory provision of hand washing facilities, sanitizers. A lot of employers, small businesses, hope that they will get some palliative to ensure that this works. And there's also the ban on interstate travels, except for movement of agricultural produce. But essentially, with managing our cases, what are some of the things you would want to see? Seeing as we're getting more and more cases, and the NCDC is working at expanding a lot of the testing and molecular labs for states.
One of the things I will keep saying is that we as individuals, we need to take ownership. We need to, what's the word now? Ensure that we protect ourselves at all costs. And that is one of the key things we need to do. Even at the government level, there's still continuous education all around. We still need to continue sensitizing people, because even as that is, with a lot of things that have been done, some people are still of the opinion that there's no COVID in Nigeria. So we still need to keep educating the people, keep sensitizing the people. But the most important aspect is for individuals to take ownership of their own health and their own safety.
All right, the non-pharmaceutical interventions.
Yes.
We appreciate your time, Dr. Olufemi Oyeko, public health physician. Thank you for joining us.
Thank you for having me.